Hello, my name is Manas Tiwari. I am the Arthrosamid clinician at Glasgow Private Clinic, and having completed over 285 procedures to date, I am probably one of the most experienced Arthrosamid clinicians. I'm certainly the most experienced in Scotland, and I'm probably one of the most experienced single clinicians in the UK. So I thought I'd do a short video just to answer a few really commonly asked questions about Arthrosamid and the procedure and what it entails. So my glamorous assistant behind the camera is going to ask a few questions from our patients.
How invasive is the procedure?
So Arthrosamid is a minimally invasive procedure. It's not like a knee replacement where you have a 20 centimetre scar and a 2-hour surgery, and it's one needle into the knee. It's done through a 0.8 millimetre diameter needle under ultrasound guidance by me in the clinic. So it's a kind of, I say it's a walk-in, walk-out procedure, but really it's a hobble-in, walk-out procedure.
And how long does the procedure take?
So total takes about 30 minutes to do one knee. You need to arrive an hour beforehand, as you'll need antibiotics pre-procedure. So you're in the clinic for a total of about an hour and a half on the day of injection.
And what about the rehab and downtime after the procedure?
So this is where Arthrosamid is probably best in class in terms of long-term relief. Yes, it takes up to 12 weeks to fully work, and I've had the full spectrum. I've had people who've been pain-free that night and then gone on to be still pain-free several months later. I've had people who have had 11 weeks and 3 days and they thought it wasn't going to work, and then they've woken up pain-free. Most people seem to find an effect around the 3 to 4 week mark, but it really starts to improve.
And what about for patients that have never heard of this procedure before? What would you tell them?
So Arthrosamid has been done for a long time. It's been done for several years. There's now over 10,000 procedures completed across Europe. I've personally done 285 of those, and I think that it's a best-in-class injectable, to be honest, mainly because of longevity. All the injectables get you sort of similar amounts of pain relief, but Arthrosamid lasts 5 years from a single injection, which is really useful.
And for patients who are considering a knee replacement, would you consider the Arthrosamid treatment as an alternative?
So I think Arthrosamid is probably a delay. Okay, Arthrosamid is a really, really good long-term injectable that will improve pain in the majority of cases and last for quite a long time. There are some patients who it won't work for. If you've got bone-on-bone arthritis, it's too far gone, it's not necessarily for you. But especially for the people that don't want a knee replacement or can't have one because of other health conditions or because of age or because of being overweight, those are the people who would really benefit from Arthrosamid in the long term.
And for patients who have had the procedure, what would you tell them if it has not worked?
So look, if these things don't work, and not everything works 100% of the time, if they don't work, then you can still progress to a knee replacement. But the idea behind this is that you don't need to.
And getting back to activity within the 12 weeks, what would you tell patients about that?
So I usually suggest no impact activity, no exercise, no sort of running, and that's usually for about 3 to 4 weeks. But then gradually returning to activity levels, the same as you were beforehand or better, over the course of the following 12 weeks. We do also give you a graduated physio program to follow, and we can offer things like a bundled physio package in the clinic in order to maximize your chance at a good outcome. Thanks for doing all the questions, really appreciate that. If anybody does want further information or wants to book an appointment, you can do so via our website really easily. Just go in, find the link to my face and click it, and it should let you book an appointment. Thanks very much for watching.